So hey guys, welcome to my new video where we'll be starting with anesthetic agents, or today we are specifically targeting on general anesthesia. Okay, so according to you, what is anesthesia? So anesthesia in simpler terms, basically loss of sensations due to drugs. Okay, now general anesthesia. Okay, so starting with the definition of general anesthesia first. General anesthesia is basically drug induced reversible loss of sensations, reflexes, and consciousness. Okay, so this is the definition of general anesthesia, where drug induced reversible loss of sensation, reflexes, and consciousness is present. Okay, now what are the where are these anesthetic agents used? So anesthetic agents is basically used in surgeries. Okay, now there are some protocols, okay, for using this general anesthesia. For example, if a person is undergoing some surgery, so there are some protocols we must know which are important. Protocols, okay, so the mnemonic is PIMSA. Okay, so P stands for pre-medication. Okay, I stands for induction. Induction of what? Induction of anesthesia. Okay, what does M stands for? M stands for maintenance of anesthesia. What does S stand for? S is skeletal muscle relaxants. Okay, and what does A stands for? A stands for analgesia. Okay, so these are the protocols which we have to follow in the use of general anesthesia. Okay, now coming to the classification of general anesthesia. Classification of general anesthesia says that it is, just a second, it is classified into general anesthesia. It is classified into inhalational and parenteral. So inhalational and parenteral. Now these inhalational and parenteral are further classified as, inhalational is classified as volatile liquid, and gases, while parenteral is classified as inducing drugs, inducing agents, and slow acting agents. Okay, now I will write some of the examples for this. Volatile liquid, it includes halothane, just a second, it includes halothane, isoflurane. Now if isoflurane is seen, desflurane, okay, and much more examples. In gases, so in gases we have N2O gas, and remember this isoflurane from this volatile liquid and N2O. I will speak about it further. Now in inducing agent we have inducing drugs such as propofol, okay, and we also have thiopentone, and these are generally also used as anti-epileptic drugs sometimes, but as a general anesthesia they are more important. Okay, now in slow acting we have benzodiazepines, we have opioids. Okay, so these are some examples where we see the general anesthesia as a drug. Okay, now going further we will talk about this term, pre-medication. Okay, so we will be talking about pre-medication. What are these pre-medication, why are they used? Okay, so pre-medication. Now what are this pre-medication, what does it mean that this is a pre-medication? So basically pre means it is given before. Okay, so pre-medication are given before the use of general anesthesia. So one of the indication of general anesthesia is surgery. Okay, now I will tell you a story. Okay, so there's a man, let me first draw the man. Okay, so this is the man, he is like indicated for a surgery, so we have to give him a general anesthesia. For example, some major surgery, so we have to give him general anesthesia, so we have to give him some pre-medication first. Now the person is very anxious. Okay, so he is very anxious, so to control that anxiety we give him benzodiazepines. Okay, so diazepam or lorazepam, clobazepam, clonazepam, any benzodiazepine we can give him to control his anxiety. Now since he is anxious, he will also have some, like, we have the other word for anxiety as stress. Okay, he will take stress, like I'm going to undergo an surgery, so the overthinking and the stress will be taken by this man. Okay, so since this word stress, remember this word stress causes stress ulcers in the stomach, as we have studied in GIT pathology. So his stress ulcers, it will be controlled by, we can give him H2 blockers. Okay, like ranitidine, cimetidine and all. Okay, now also we have to, like, before an surgery we need the bowels to be empty and the stomach and all should be empty, so gastric emptying is required. Okay, gastric emptying is required. So this gastric emptying, which drug can we do, which drug can we give to the patient? Yeah, we can give drugs like the prokinetic, which is metclopramide. Okay, for gastric emptying. And you have, like, sometimes you have experienced, if you are under very much stress, very much anxiety, you are prone to have vomiting and all. So to control vomiting in this patient, we give antiemetics. So in antiemetics we have the ondansetron, which is the drug of choice. Also sometimes the prokinetic metclopramide is also used. And also now to relieve the pain, okay, after surgery and sometimes before surgery we have pain. To relieve pain, morphine is given. Okay, now we have seen that when there is too much stress, okay, so what happens is it stimulates the vagus nerve. Like we have seen, if there is increased intracranial tension, we have like earlier we have stated this term stress ulcers. Okay, so this stress, what does this stress causes? This stress basically it causes the vagal stimulation. Now, how does this vagal stimulation is caused? Because of increased intracranial tension. Increased intracranial tension due to stress will cause the vagal stimulation. This vagal stimulation will further, what it will do, it will increase the parasympathetic effects. Okay, so parasympathetic effects like increased salivation. So to control salivation, and also vagal stimulation, the effect on the heart will be vagal bradycardia. Okay, so to control this effects, we give atropine, which is a muscarinic blocker. So we have decreased salivation, the vagal bradycardia is also reduced. So do you understand that story? So a person is going under surgery, he is very anxious, he is very stressed. So to control the anxiety, we give benzodiazepines. To control the stress also due to increased intracranial tension, we give him H2 blockers. Then for gastric emptying, we give him prokinetic like metclopramide. Then if the person is vomiting, we give ondansetron and we give metclopramide. Then if to relieve the pain, we give morphine. And due to increased intracranial tension, the vagus is stimulated. The vagal stimulation causes vagal bradycardia, which is controlled by atropine, and also the salivation or any secretion which is controlled by atropine. So these are the pre-medications which should be given in case of using general anesthesia. Coming to the mechanism of action. Okay, so mechanism of action, it is very easy. Okay, so we have to just write the site of action is reticular formation, neuroanatomy, reticular formation. And if you stimulate the reticular formation by these drugs, the general anesthetics, what will be the immediate effect? So the effect, basically it stimulates the inhibitory neurotransmitter. Okay, so this inhibitory neurotransmitter, the examples are GABA. Okay, and it inhibits the excitatory neurotransmitter. Okay, and the examples are glutamine, we have acetylcholine, and many such, NMDA. Okay, so these are the excitatory neurotransmitter which are inhibited, and the inhibitory neurotransmitter are activated. Okay, so this is the mechanism of action. So till now we saw at first the definition of general anesthetics, then we saw the protocols which should be followed. The mnemonic was PIMSA, pre-medication, then induction of general anesthesia, maintenance of general anesthesia, skeletal muscle relaxants, then analgesia. These are the protocols. We saw the classification of general anesthesia where they are given as inhalational or parenteral. Inhalational is further divided into volatile liquid or gas. Then parenteral is further divided into inducing and slow acting agent. Then we saw that story for pre-medications. What are the pre-medication which are indicated in the before the use of general anesthesia. Then we saw the mechanism of action of general anesthesia. Now tell me one thing, if we give the general anesthesia, if we infuse the general anesthesia in the patient, now there are something called as the stages which are defined for, which is confined for general anesthesia. Stages of general anesthesia. So basically there are 4 stages. Okay, first stage says stage of analgesia. Okay, so the stages of analgesia. What is the stage of analgesia? Basically here the patient is conscious but he is drowsy. Okay, second stage is stage of excitement. Okay, Stage of excitement states that the patient is patient has lost consciousness and there is increased sympathetic activity. Okay, now the third stage, it says stage of surgical anesthesia. So basically, stage of surgical anesthesia means if you observe any surgical procedure, like a major surgical procedure, the patient is unconscious. Okay, then the respiration which we observe in a surgical patient, okay, the respiration is normal respiration, means the intercostal muscles are not acting. What does it mean? The intercostal muscles are paralyzed, meaning to say it is a normal respiratory procedure. Okay, then the reflexes are lost. Okay, now stage 4 states that it is a stage of vagal, we will use a broader term, stage of medullary paralysis. Okay, one thing I forgot to add, in the stage 3 of general anesthesia or surgical anesthesia, the muscles are also relaxed. Okay, coming to the fourth stage of medullary paralysis. Medullary paralysis states that there is the respiratory and vasomotor centers are depressed. So if this stage 4 pertains for a longer time, it will lead to coma and death. Okay, so stage 3 is preferred, but if it goes to stage 4, it is generally coma and death. Okay, so these are the stages of general anesthesia which we will observe when the general anesthesia is infused. Okay, the 4 stages. Now coming to some of the drugs. Okay, so propofol. So what was propofol? Under which class, which subclass did it arrived? Yeah, under the inducing drug, which was under the parenteral preparation of general anesthesia. So propofol is basically, the mechanism of action is to activate the GABA channels. Okay, the GABA channels, it will cause hyperpolarization. Okay, which will lead to increased Cl- and further relaxation. Okay, now it is the most commonly used general anesthesia. Okay, it is available as 1% emulsion for intravenous administration. Okay, it is metabolized by liver and excreted by kidney. One additional point, it has anti-emetic effect. Okay, and since it is a intravenous, it do not cause irritation to airways, so can be used in asthmatics. Okay, and one more point to add, it is the most common GA, general anesthesia, used in outpatient surgical process. Okay, so this was all about propofol. One another drug which I didn't mention earlier is ketamine. Ketamine, it comes under the class of inducing drugs. Ketamine comes under the class of slow acting drugs. Okay, it is one of the most important drug. It is slow acting. Okay, it is have a good analgesic effect. Good analgesic effect. All the anesthetic effects are observed by ketamine. Also it is called as a dissociative anesthesia. Dissociative anesthetic. Okay, because it is causing effects like sedation, amnesia, unresponsiveness to surrounding, rigidity in muscle. Patient can open eyes but unaware of surrounding. Okay, so ketamine is one of the most important drug. Most important drug. It also causes bronchodilation and sympathetic stimulation. And one of the most important point, it is well tolerated by children. Okay, now we come to this point where we have highlighted isoflurane and N2O. So isoflurane and N2O, it basically are the, let me just write it first, isoflurane plus N2O. So they are basically used as the maintenance therapy for general anesthesia, where isoflurane, okay, under which class does isoflurane comes? Isoflurane comes under the first class, the volatile liquid, and this N2 comes under the gases, and both are via inhalational route. Now isoflurane and N2O are given as the fixed dose combination, okay, FDC. Now why they are given as the FDC? So number one reason, let me just, okay, the number one reason is due to the N2O is a liquid, N2O is a gas, so N2O rapidly diffuses in cells, and due to this isoflurane also diffuses rapidly. Okay, so a synergistic effect is observed. Then the isoflurane, the concentration is reduced. Concentration of isoflurane is reduced. Okay, so recovery is fast. Okay, reduction of dose is also there, so recovery is fast. Now isoflurane, the most important, isoflurane, let me just write isoflurane and N2, and this point, it is the one of the most important point. Yes, let me highlight it. Isoflurane is a potent anesthetic and a poor analgesic, whereas N2O is a potent analgesic and poor anesthetic. And now the FDC is clear that if we combine the two drugs, we get the potent anesthetic as well as a potent analgesic. Okay, so this was the most important point why these are given as FDC. Okay, a synergistic effect is observed in this combination. Okay, now there's one term which is known as MAC, minimum alveolar concentration. So this term minimum alveolar concentration is basically, it is the minimum amount of general anesthesia in body. Okay, minimum amount of general anesthesia in body. Okay, and majorly the alveoli. So therefore alveolar concentration. Okay, minimum amount of general anesthesia in body, specifically alveoli, which is required to produce immobility when a painful stimulus is given. Okay, so minimum amount of general anesthetic in alveoli required to produce immobility when a painful stimulus is given. Now this was all about general anesthesia and overview about general anesthesia, where first we saw the definition of general anesthesia, then we saw the protocols for general anesthesia, which include pre-medications, induction, maintenance, skeletal muscle relaxant, analgesia. Skeletal muscle relaxants will be covered further. Then we saw the classification of general anesthesia, where it is classified as inhalational and parenteral. Inhalational is further classified as volatile liquid and gases, and parenteral is classified as inducing agent or slow acting agent. Further going, we saw pre-medication of the story of the man who is undergoing surgery, then the mechanism of action of general anesthesia, and stages of general anesthesia, where it included 4 stages. The 4 stages are named as stage of analgesia, stage of excitement, stage of the surgical anesthesia, and stage of medullary paralysis. Then we saw propofol, ketamine, the fixed dose combination of isoflurane plus N2O, where the reasons were the synergistic effect, the 3 reasons where N2O rapidly diffuses and it also helps halothane to diffuse. Then the dose requirement is less, so recovery is more. Then isoflurane is a poor analgesic and a good or a potent anesthetic, and the N2O is a poor anesthetic and a potent analgesic. So if we combine the 2 drugs, a synergistic effect is observed. Then we saw the term minimum alveolar concentration, where the minimum concentration in the alveoli which is required for immobilization when a painful stimulus is given. So this was all about the general anesthesia. Thank you.